This is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. Nigeria's Minister of Women Affairs, Pauline Tallen, has said for Nigeria to achieve a majority of the United Nations Sustainable Development Goals by 2030, it must address issues of female genital mutilation in the country. The minister said this while speaking at the launch of the Movement for Good to End FGM in Abuja on Thursday. Tallen said the 2030 targets of health and well-being, quality education, gender equality, decent work, and economic growth cannot be achieved except FGM is eliminated in the country. An Australian rule banning many UK residents from giving blood over fears they could spread Jacob disease has been scrapped. For 2 decades, anyone who lived in the UK during its mad cow disease crisis were barred from donating blood. In rare cases, the fatal illness has been spread through blood transfusions. But citing a review of epidemiological data and expert advice, Australia's health regulator said the cohort would no longer be excluded. Consequently, people who lived in the UK between 1980 and 1996 would soon be able to roll up their sleeves to give blood or plasma. And the World Health Organization, WHO, in its latest report has said Africa is witnessing a surge in outbreaks of vaccine-preventable diseases over the past year. According to the WHO, almost 17,500 cases of measles were recorded in the African region between January and March of 2022, making it a 400% increase compared with the same period in 2021. The Global Health Agency stated further that 20 African countries reported measles outbreaks in the first quarter of this year, and more than that in the first 3 months of 2021, adding that outbreaks of other vaccine-preventable diseases have also become more common. Again, the World Health Organization has announced that the Democratic Republic of Congo has kicked off Ebola vaccinations to control the outbreak in the northwest city of Bandaka. It was reported that 2 people have died so far in the city of over 1 million inhabitants, where people live in close proximity to road, water and air links to the capital Kinshasa. TOS Health Desk understands that the first death occurred on April 21 and the second on April 26, making it the Central African country's 14th Ebola outbreak. The Edo State Primary Healthcare Development Agency has said it is ready to begin the second round of oral polio vaccination for children between ages 0 to 59 months from May 7. The Health Education Officer of Edo State Primary Healthcare Development Agency, Irene Waba, disclosed this in a statement on Thursday in Benin. The statement read partly, "This is to inform the general public that there will be a second round of oral polio vaccination for children between the age groups of 0 to 59 months, that is less than 5 years of age." Welcome back. A South African professor, Helen Rees, has urged African countries to strengthen research and develop new technologies to make Africa's vaccination efforts more efficient. Rees, who is the executive director of WIT's Reproductive Health and HIV Institute, said this to enable Africa to prepare adequately ahead of pandemics. And health officials in Gombe State on Wednesday said 5 pupils and a teacher died of Lassa fever in an almajiri school in Kaltungo Local Government Area of the state. Almajiri system of education is a form of Islamic education practiced in northern Nigeria, where young children leave their homes to live with Islamic scholars to learn about religion. However, the system has come under heavy criticism for allowing pupils to roam the streets of towns across northern Nigeria without guardians or care, begging for alms and committing criminal acts. The coordinator, Kaltungo Primary Healthcare Comfort Danlami, said 76 suspected cases of Lassa fever were also recorded in the Dogon Ruwa ward in the council area where the Almajiri school is located. And the World Health Organization, WHO, country representative Walter Mulumbo has said Nigeria is expected to receive approximately 9 million doses of oral cholera vaccines Mulumbo said this while speaking at the opening ceremony of the Global Task Force on Cholera Control Training on OCV Request and Campaign in Abuja. Mulumbo said the expected vaccines will ensure the implementation of 2 campaigns in 14 local government areas across 9 states, including the Federal Capital Territory. And health officials have said there are evidence that a common virus is linked to rare cases of hepatitis that have been occurring in some young children. Globally, there have been 169 cases recorded and 1 death. The UK Health Security Agency therefore urged parents to look out for symptoms such as jaundice. It was gathered that in the UK, at least 114 children have become ill and 10 have needed a liver transplant. Singapore has announced that it would lift a ban on single women who wanted to freeze their eggs for non-medical reasons. But while many have welcomed the measures, others say there are still requirements for the procedure Singapore must put into consideration before the policy can be considered truly inclusive. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS TV Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS TV Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.